board members play a critical role in their hospitals and communities. This episode explores ways we can elevate board education so that trustees can make the best decisions for the communities they serve.
Board education will always need to include governance. Because we are a nonprofit healthcare system with people coming and going from our board, they will always need updated and refreshers in governance training. And of course, patient safety has become a much bigger issue for all of us these last few years. The board needs to understand and be included in the details of what we're doing to keep our patients safe. The events of the last year have brought new challenges for us with inclusion, diversity, mental health issues of our workforce, and all that needs to be included in that education.
I do see board education changing a lot over the next 1 to 3 years. While in-person education will still happen through board meetings and state and national conferences, I believe that there will be a need for more on-demand education using podcast, videos such as this, and webinars. I do want to stress that these modes of communication should be brief, though, so that board members have the time to listen to them.
I think that the opportunity for enhancing learning, and I say learning distinguished from just education, but ongoing learning for board members, it needs to be ongoing, evolving. It can't be episodic, right? It can't be fragmented. Today, we take a few board members to a conference once a year, and then we check that metaphorical box like we've done our job, right? That's not how learning gets done. We don't do that for our kids. We don't do that for our physician leaders. We don't do that for our nurses in our hospitals. We can't possibly ask that of our board members.
As we educate our board, we are dealing with the same variables we all have in our day-to-day life. We don't have enough time. So we need to make sure that the board education is succinct, it's smart, because these are discriminating people. They have other things to do. They're donating their time to our boards.
So there's so many challenges that trustees are going to be facing, especially financial challenges after the COVID-19 pandemic. There's also a lot of changes in quality and patient safety, and frankly, the move out of acute care to post-acute care and population health. So educating boards about these issues will be critical going forward.
Our boards will be engaged if we are relevant, if we stay current, if we make sure that the information that we're giving them is benchmarked, that it can relate to other organizations that are in healthcare. If we keep the information short and smart. We can also leverage technology as we've had to for the last year.
So some examples that can help inspire and encourage engagement in the boardroom is the board chair starting off or having a couple of board members as plants to begin the dialogue. It's important for trustees around the table to feel comfortable about the issue, but we need to remember for them to feel comfortable, they need to be knowledgeable about the issue to ask the questions.
I came up with the idea last year of trying a debate with the board, just like we did in high school on the debate team. So we divided the board into pro and con, put out some of our most difficult strategies that we were struggling with, whether to build a hospital in the rural area, whether to employ physicians, how we should present ourselves to our consumers. And we had the board debate that. It was fun, it was energetic, and they've asked us to do it again.
Let's make a commitment, a declaration. It's central to the whole exercise. In the absence of a commitment, you're not going to get participation from board members, nor should we. And so baking that into the charter, signing a pledge, making a declaration up front is one thing that needs to be done. And that includes naturally building a board governance education.
Consumerism is a big part of our discussions at a governance level. We know that the future livelihoods of our organizations, the future success of our organizations will be dependent on how well we connect with the changes in our consumers. And we know the changes are significant. Demographically and medically and scientifically, we need to continue to be updated on those things. Ambulatory services, experts in surgery centers, access to care, community engagement, social determinants of health. All of these things are very important for our future to incorporate into the work we do at the board level.
I suggest bringing in experts or folks who can help you begin a dialogue on health equity, equality, diversity, and inclusion. That's a large issue, not only for our communities, but for our country. Boards really should get on board and begin having these discussions, and having an expert come in and talk to them about it and help facilitating dialogue, I think, is critical.
Well, knowing the challenges that are out there, time being a problem, there's a scarcity around time. Money, there's a scarcity around money. We need to be thinking about tapping into education solutions that solve for those problems, right? And to my mind, there are a handful of characteristics that make certain kinds of education smart and education effective. And those are things that are short and sweet. Those are things that are interesting and engaging, experiences versus just information, and making learning actionable, digestible, and ultimately content that can help go beyond the content and help try to facilitate deeper conversations, board member to board member.
As a leader of a nonprofit hospital system with a 2 to 3% operating margin, we don't have a lot of capacity for expensive board education. So what we've learned to do is plan ahead, survey our board on what they need, utilize the tools that we find at the American Hospital Association governance tools, look for experts locally at our university, and really try to be creative about bringing people in. I've actually written to authors of some of the books that we've read and have had them volunteer to come and speak to my board at no cost. And of course, it's always creative to use an internet-based governance learning platform that the board can do at their own convenience. In fact, we've actually got a competition going here between our board members to see who can do the most courses and be number one on the leaderboard.
I think it's so important for trustees to network with their peers, either across the country or across their states. Sharing best practices and learnings, what works in one community might help another community. Obviously, we can do this in in-person conferences, but we can also do this virtually in meetings where there's breakout sessions or where there's opportunities for all of us to share stories with each other.